Okay, good afternoon, everyone. We'll make a start. So before we start, I'll just read out the usual housekeeping reminders. So the meeting this evening will be live streamed to the public. A recording of the meeting will be available on the council's website within 24 hours of the meeting. Attendees are required to wear face masks on entry to the building and meeting room, which may be removed when seated. Would everyone in the hall please ensure you have scanned the QR NHS COVID app poster with your mobile phone located in the entrance of to the chamber. Would members and officers please remember to switch their microphones on when speaking and speak directly into the microphone, and switch microphones off when finished. Reporting officers joining the meeting using Teams, use the hands up icon on your screen for questions and comments. Please turn your cameras and microphones on. Switch off mobile phones or place them on silent mode. Okay, so we'll move on to the first item of the agenda, which is apologies for absence.
Yes, Chair, received apologies from Councillor Kershid, Councillor Moles, Co-optees Joe Miles and Debbie Main, and also Amanda Lewis.
Thank you. And then we'll move on to item 2, which is to confirm the minutes, which are obviously included in the agenda pack. Do we have any comments on the minutes? So we can consider those minutes approved. Yeah. Thank you. Moving on to item 3, disclosures of interest.
None that I'm aware of, Chair.
Thank you. Anything in the room, Terry?
Yeah, I'd like to declare an interest in, as a governor of Richmond Hill, what is it now, the Queen Elizabeth High School, formerly Ashcroft, and the virtual school.
Thank you. And
I'm also a governor at Grasmere School, Warden Hill Infants, and the Meads Primary School. Thank you.
Thank you. Cool. Moving on to item 4, any urgent business? I certainly have none to report. No?
None from me, Chair.
Thank you. Moving on to item 5, references from committees and other bodies. Again, I have no references received.
None, Chair.
Thank you. Item 6, Chair's update. So I have no updates to report since the last meeting. So we shall move on to item 7, which is the SEND performance scorecard, which is with the Interim Service Director for Education.
Thank you, Chair, and good evening, members. The paper that you have in your pack with a focus on the SEND performance scorecard is a summary of some of the key performance indicators that local area partners will be sharing with our regulators during our pending SEND re-inspection process. SEND re-inspection process will be undertaken by Ofsted and the Care Quality Commission, and they will be visiting us shortly. We haven't got a defined date yet, but we know that we are in the next round, if you like. So we are anticipating the call any week now. And the focus for the re-inspection will be how far have local area partners progressed since the previous inspection at the back end of 2018, where the local area were faced with 5 significant weaknesses and asked to submit a written statement of action, which was approved by Ofsted. And since the inspection date, local area partners, and I say local area partners, this isn't just a local authority, this is our CCG, so Commissioning Quality Group, our health partners, have been working together with the local authority and the full system in progressing the implementation of the SEND reform. So you have a number of metrics there, which we'll be sharing with the inspectors, which give a flavour for progress against some of those key indicators. But really, as I say, I'm sure colleagues have seen it. I'd like to bring in my colleague, Catherine Barrett, who's our SEND Programme Director, who is leading on working with the partnership and with members in pulling together our performance indicators. And now I've previously reported to this forum on some key headlines in terms of readiness for the re-inspection, but if you like, the scorecard is going to be one of the tools in our toolbox in terms of illustrating progress and the direction of travel with regards to progress against those indicators to provide assurance to the inspectors when they do visit us. So if it's okay with the chair, I'd like to bring in Catherine just to provide a high-level overview, because Catherine's been working with our performance team in putting this together. So Catherine, would you like to come in?
Basic mistake, forget to turn the mic on. Good evening, I'm Catherine Barrett. So I'm going to take you through some key headlines behind the data that's provided in the report, which I hope will give you more of a flavour of where we're at with our SEND programme in Luton. So currently Luton maintains 1,941 EHCPs for children and young people in Luton. And over the last 3 years, we have seen an upward trend in pupil numbers within EHCP. That's detailed in your report. And we've increased from 1,542 in 2017 to 18 to 1,896 in 2019 to 20. And as I said, that now stands at the 1941 mark. Just a little bit of context behind those figures are we have more male pupils who are subject to an EHCP than female. And for example, in Key Stage 1, 62 females with an EHCP compared to 177 males. So that distance between the two is quite significant. As regards ethnicity, the makeup of our EHCP pupil population is Pakistani is 493, White British 469, and Bangladeshi 202. And those are fairly significant outliers compared to the other ethnic groups. In relation to the broad category of need behind our EHCPs, the largest category of need is communication and interaction at 51%, and behind that, cognition and learning stands at 22%. Stop me if I'm giving you too much detail, but I just wanted to try and bring these figures to life for you.
Can I just stop you for a moment? Sorry. We're back to these abbreviations again, aren't we? We were promised a glossary. It hasn't come forward, and I really don't know why we keep asking these things and nothing happens. It just annoys me. But what is the EHCP?
Oh, I'm sorry, it's the Education Health Care Plan.
Right. Okay. I'm sure there'll be others I shall mention later on, but okay. Thank you.
Sorry, Chair, can I just come in on that? It's, as I say, it's an appropriate challenge. First time I've heard that, but I will make sure that if that has been the ask of this forum previously, that our reports going forwards, we will ensure that we reduce the usage of education or acronyms, and where there are acronyms such as industry language acronyms such as EHCP, there is relevance to it. So colleagues are very clear on it. So colleagues like that gentleman there doesn't need to ask that question in the future. Yeah, thank you. That was sort of discussed in the last meeting. So if a glossary could be provided, it would be very helpful for us lay persons. Thank you.
I can assure you, you're not the only department that does it.
Thank you. As regards compliance, so we have a key performance indicator of the number of EHCPs which are issued within 20 weeks. And in the pack, in the report that you've got, the data that's shown there is EHCPs issued, including exceptions. And so the report shows a 4-year trend of EHCPs issued within 20 weeks, including exceptions, where in 2020 our performance rose to 65% against a national rate of 55.6%. What I also want to tell you about is the number of EHCPs issued, which excludes exceptions. And Luton has consistently performed better than the national rate. And in 2020, our performance was 68.7 against the national rate of 58%. So an EHCP is issued and it is then subject to an annual review. And the abbreviation for that is AR, but it is an annual review. And again, we've seen an improving trend. So in September 2020, there were 37 annual reviews due to be held in month, and only 12 were held, which equates to 32.4%. What we're now seeing in June of 21, 122 annual reviews were due to be held, and of those, 81 were issued, equating to 66.4%. So we've seen an increase in the numbers required and an increase in the performance. Another KPI we are measured against is where reviews are held. So the annual review is held and that the local authority sends a 4-week decision letter on time. And again, using the baseline of September 20, 67 reviews were held in the month, of which 22 letters were issued within 4 weeks, equating to 32.8% performance. In June 21, what we see is 138 reviews were held in the month, of which 122 letters were issued within the 4 weeks compliance period, equating to 88.4%, so a significant rise in performance there. Taking you back to the report, there's some data there around fixed term exclusions. And what we can see is fixed term exclusion rates for pupils with an education healthcare plan or special educational needs support is above that of pupils with no special educational needs, although they are below the national rates and continue to follow a downward trajectory. As regards permanent exclusion rates, in 2017-18, 28 pupils were permanently excluded who were subject to an education healthcare plan or in receipt of special educational needs support. That number has decreased, and in 2020 to 21, we now see 11 pupils with an education healthcare plan or SEND support permanently excluded. Absent rates. The absence rates reported in the report show that absence is in line with national trends, and rates for pupils with education healthcare plans are in line with the national rate of 8.7%. And as regards persistent absence rates, which is where a pupil misses 10% or more of their expected timetable, what we're seeing is absenteeism of pupils with an education healthcare plan are higher than the national rate at 25.9% to compare to the national rate of 24.5%. Electively home educated children. In the summer term of 2019 to 20, 251 pupils were electively home educated, of which 5 had an education healthcare plan, equating to 2%. What we've seen is an increase, particularly over the COVID period. And now in August 20 to 21, we saw 371 pupils were electively home educated, of which 16 had an EHCP plan, an education healthcare plan in place, and that equates to 4.3% of the overall rate. Children missing education. In the summer term of 2019-20, 91 children were missing education, of which 1 had an education healthcare plan. Those figures have risen overall, so we've got 155 pupils recorded as children missing education, but the number of children missing education with an EHCP has definitely remained stable, and it remains at 1. Nearly there now. So going into social care, the number of clients known to the Youth Offending Service in Luton who have special educational needs support has reduced from 41 in April of 21 to 23 in August of 21, which is great news. And the number of clients with an education healthcare plan has remained relatively stable, but has increased from 15 in April 21 to 19 in August of 21. Thinking now particularly on our social care data, children with an education healthcare plan, this is children in need, has risen from 305 children in April 21 to 315 children in July of 21. And we see a similar picture with our looked after children, where again we see an increase in children with an education healthcare plan from 58 in April 21 to 71 in July of 21. Some good news there. We've seen a decrease in our child protection children with an EHCP plan, and that's reduced from 15 in April 21 to 12 in July of 21. Because the SEND Special Education Needs and Disability agenda goes from 0 to 25 years, I wanted to include some data here just around our adulthood. And the number of young people with an education healthcare plan or who are post 16 with an education healthcare plan in supported internships has risen from 11 in 2017-18 to now 26 in 2020 to 21. And the total number of adult social care clients aged 18 to 25 years who had or have an education healthcare plan in receipt of services in April 21 is now 42. So that gives you a flavour of the range of information that we are now able to collate and report on from our Special Education Needs and Disability scorecard. We also have data from our health colleagues as well. So happy to take any questions.
Thank you. Before I move on to questions from the floor, I'll just like to ask a question myself in relation to the figures on persistent absence. What plans are in place to reduce that, and is there a, if you like, a trend in what causes the persistent absence?
Chair, can I take that first and foremost? In terms of persistent absence, there is a national challenge with regards to persistent absence, and there's a programme of work, a core offer working with all of our schools to look at attendance, but also a targeted programme of work where some of the attendance issues may be a little bit more entrenched. So we do have an education welfare service who do work proactively with our schools and with our families. But then we also bring in our partner agencies as well to support that. So there are ongoing programs of work to try and remedy those problems. So each case is different in terms of the reasons behind that. In some cases, it's disengagement. So we need a program of family support, interventions. We might even have to bring in enforcement agencies in some cases. For some of our children and young people are disengaged with teaching and learning. So then it's about re-engaging them with teaching and learning to find the right offer that's going to be responsive to their needs. So we're talking about lower numbers, but at the same time, it's lower numbers that do cause concern. But there are programs of work ongoing.
Thank you. Thank you. So we have questions from Dr. Mohammed Al-Marahi. Is that correct?
Thank you. Thank you, Chair. In terms of the rate of exclusion rate, I'm interested to hear if there is any ethnicities breakdown as far as the exclusion rate is concerned. I know that the speaker has highlighted that there is provided some ethnicities overarching picture on that, but I'd like to hear if we have any specific data on exclusion, and if the data tells us that the ethnicity is obviously diverse ethnic group, and we talked about this in previous meetings. We said that Luton is a super diverse town. We have the number of pupils identifying themselves as BAME, Black, Asian, minority ethnic. We're talking about 80% according to the paperwork presented to us in previous meetings. So that is a very, very high. And that begs the question whether there's a reasonable adjustment made to make sure that the diverse needs taken into account. And of course, I hear what has been just said regarding the engagement with families, that this diverse needs being taken into account. Thank you.
From the scorecard, it doesn't break down ethnicity of our permanent exclusions. So no, I'm not able to report on that.
Thank you.
Would it be helpful maybe to have a breakdown? Sorry.
It's a really good question, because when we are looking at the work of the Behaviour Inclusion Wellbeing Programme of Work, the BWAB strategy, which has come to this forum before, led by Councillor Malcolm, and the engagement of partners across crime reduction, education, social care and health, in terms of coming together to shape that strategy, now getting onto the implementation phase, Absolutely, Councillor, that will be an important part, how we begin to drill down, not just looking at patterns and trends and reasons for exclusions and which particular groups might be more at risk of exclusion, but also looking at some of the schools where there is a high level of exclusions as well. And then you think, in terms of, is there a degree of support required for the school? Is it an improvement issue? Is it a standards issue? So when we really break that data down beyond the high level figure which you have in your pack here, then it allows for more targeted pieces of work. But as my colleague Caron has said, with regards to when it comes to reporting to Ofsted ahead of the SEND inspection, with a focus on what we have here is what the requirement will be for the regulator. When we wish to really drill down beyond those figures, then it allows us to actually be more targeted. But that's part of our local behaviour inclusion wellbeing strategy programme of work and the implementation, where we will drill down which groups, which cohorts, which schools, which settings. But for the SEND scorecard piece, in response to the regulator ask, obviously this is what we are asked to produce for the regulator scorecard element.
May I come back, Chair?
Yes, certainly, go ahead.
Thank you. I'm saying this because when I look at the data and the trend, we seem to be above the national, the national average on all the exclusions parameters that are presented to us in the report. So that actually, I'm also thinking about Dr. Linda Delmar report, which was presented to this committee previously, where she made that correlation between understanding the needs with that might be an answer really to address those important questions and be for the benefit of the children in Luton. Thank you.
When we look at the exclusion data, just for the benefit of colleagues to be clear, it is 2020 data. It is a lag measure on this. Exclusions data is 12 months in arrears. So it is 12 months ago, and I understand that's what led to the need to pull together the behaviour, inclusion, wellbeing strategy with significant investment of time, energy and resource from professionals, parents, carers across the local area. So I understand the high exclusions was actually a driver. So it was on the back of those high exclusions, significant body of folk coming together, putting together a strategy, getting on with implementation. So actually, if I was coming in now to Luton and saying, looking at the exclusion data, what is Luton's response? And we didn't have that strategy and that plan of action and that level of engagement in place. Retrospectively, I'd be looking at putting that in place. So looking at it with an alternative perspective, I'm saying that pulling that strategy together, there are moves in the right direction. Having the data, as our councillor said, allows us to ask better questions with regards to which groups, which trends, which patterns, which schools, and so forth. But there is a strategy in place. There is a plan in place to remedy this as well. So it's an absolutely appropriate challenge. But there is now the group in place with the mechanism to progress this agenda.
Thank you. Do you have any follow-ups, questions, Dr. Randy? No? Okay.
Fine, thank you.
Okay, so I think we have Councillor Keynes and then Councillor Petts. Yeah. Oh, sorry. We'll go. Sorry, were you earlier? I didn't see you. Sorry. So Councillor Keynes. We'll go Councillor Petts and then Councillor Love. Thank you.
All right.
Keynes, yeah.
Item 16, elective home education. You've actually written that out properly. That's good. Well done. Who monitors the home education? How do we know they're getting the proper education and not other sorts of education? I should imagine this has gone up during the COVID problem. But can you just tell me how we monitor this?
With regards to elective home education, local authorities have limited legislative levers with regards to monitoring. Parents will have to register their children and make a decision if they wish to electively home education. Our Education Welfare Service then will record the children who are home educated, and then they will be keeping in touch. So basically, we have no right to quality assure the work or any activity that's undertaken. And that's not a Luton challenge, that's a national challenge. There was talk recently about government changes in legislation and policy to give a local authority more legislative capacity and levers to address that. But in terms of monitoring the work, no, local authorities don't have that level of autonomy and power. What we do know is how many children and young people are elective home educated, then there is an approach, then it's necessary for local authorities to have connectivity. So we will stay in touch with these families, but Councillor Keynes, in some response to your query, with regards to monitoring, the local authorities do not have the level of autonomy to monitor.
It's a bit worrying, though, isn't it? Then, because you've got a group of children which could be being taught all sorts of things. How do they get on then with exams?
Many children, young people in elective home education, some of them may not take exams, some of them they can register for examinations themselves by alternative routes as well. So there are many parents who home educate their children and they educate their children highly effectively. There are a number of national groups with regards to elective home education. So I don't want colleagues thinking that it's a free-for-all and it's high risk. Yes, from a local authority's perspective, our view would be that if children and young people are not in school, they're not in teaching and learning, we would hope that they're accessing education according to their age, aptitude and ability that's responsive to their needs. And for many cases, we hear only positive things, but there will always be a potential for risk. A number of years ago, there was a high-profile Isle of Wight safeguarding case where there was a safeguarding issue with regards to a child who was elective home educated. And that actually, on the back of that, government did change policy and legislation. But did it go far enough? I think the department would feel that potentially it could have gone a bit further. But there is talk at the moment with Select Committee looking at the powers and the legislation around elective home education to give local authorities more autonomy and more powers in this regard.
I think it's quite worrying, to be quite honest. Yet there could be a load of kids that are going to drop through the system completely. Yeah, okay. And if we're relying on the government to change it, live in hopes.
Councillor Keynes, I could not possibly comment on that, but in terms of legislative levers that are available to local authorities to intervene when it comes to elective home education, the powers are very, very limited, and unless something is brought to the attention of local authorities, then we can use safeguarding powers and so forth, but it's a reactive measure as opposed to a preventative measure.
Councillor Petts.
Yeah, can you tell me how these figures correlate with deprived areas? Do you break them down?
Break them down. Which figures specifically are you alluding to?
Well, the exclusion figures, basically.
I think Councillor would go beyond the written scope of the SEND scorecard element. Now this is looking at, because again, the scorecard is in response to what we will have to produce for the regulators for the SEND reinspection process. If we're talking about a breakdown and of exclusion figures, we can provide that for you. Absolutely, we do have that data. But
might be an interesting figure.
I think it could be a future conversation for this committee if that's something that the committee would like to look at. We have exclusion breakdown by ethnicity, by year groups, by schools and things like that. That data is available. But again, a gentle reminder, this data is last year. It is 12 months behind, but good data gives you good insights, doesn't it? It allows you to ask better conversations and better questions and so forth. So, but that data is available. But for the purpose of a SEND scorecard, the Special Educational Needs and Disabilities scorecard, Councillor Keynes, just to break that acronym down, for the purpose of this ask, it very much is a case of what is it we're going to be sharing with our regulators at the reinspection, which is what you have. But in terms of the BWAP, the Behaviour, Inclusion, Wellbeing group, they will have more data available. But that's broader. That's not just a focus on SEND. That's a focus on the whole system.
Okay, maybe this question isn't for this group, but I'll ask it anyway, and you can think about it.
Ask away.
What about the unregistered schools? Because at one time we were sitting around 7 or 8 that we knew about. Is that trend going up or down? Do you know?
If we identify a school that's unregistered, then naturally we would be reporting that to Ofsted, and Ofsted will follow formal due process. In terms of, since I've been working with the local area, I'm not aware of the trend increasing. If an unregistered school is brought to our attention, then we will follow formal due process. But at this moment in time, I'm not aware of it exceeding that number.
Okay, thank you.
Thank you. Yeah, I mean, if, certainly for a future meeting, if we could take a look at the breakdown by ethnicity, I think that'd be very useful. Yeah.
We can put it on the forward plan. I think it's an appropriate conversation to be having, and I would say it would be good to come back maybe as a wider piece of work with regards to the impacts of the behaviour inclusion wellbeing strategy, because that's been here as a programme of work, of which exclusions will be part of that, and then the drill down around exclusions as well. So rather than just look at exclusions specifically, thinking around the join up between the behaviour inclusion wellbeing strategy has been here for approval, sign off. Maybe it would be a good question to ask what's been the progress with that, of which the exclusion data will be presented as a part of a wider piece of work.
Thank you. Councillor Lovell.
Yeah, thank you, Chair. Just wanted to comment on point 20 and 21. Point 20, that it's positive to read that the average found the year end in March 2021 that is being lower than the average, and it's also the youth offending services clients with an EHCP plan have remained relatively stable. But what I wanted to ask is point 21 is the slight increase in the number of looked after children with an EHCP, that what has contributed to that, to this increase?
Okay, well, we're seeing a slight increase, and nationally, we go back to the increase in issuing of education, health and care plans nationally. Since 2014, the increased demand in specialist provision has increased 50%. 2018, 2.8% of local area children and young people were issued with an education, health and care plans. 2019, that went to 3.1%. 2020, that went to 3.4%. 2021, that's forecasted to go to 3.7%. So that's nationally. That's nationally. So it's a national trend as well, increasing demand and complexity and need. So Luton is not an outlier in terms of in its growth in that space.
Thank you. Councillor Wahid.
Thank you, Chair. Councillor Lovell just asked my question. I'm highlighted. That's good to know. Another just is paragraph number 17. It says during COVID-10 pandemic. Is that COVID-19? Is it typo or what? Yeah.
Can do another one.
No, thankfully, I think it was a typo.
Thank you very much. That's not a good look for the education department, is it?
Okay, thank you. Any other questions or comments? Nothing from the floor? No hands raised online, so thank you. Oh, Councillor Wahid.
I just want to say that we welcome the school, the new school, the SEND school that's open. What date was it open, on the 13th or something?
It was open last Monday, the 13th.
13th. Yeah, that's brilliant news. Yeah, thank you.
Yeah, I think the Windmill Special School is a welcome addition to our local offer.
Absolutely, yeah.
Lots of media interest as well, actually, who ITV wish to come and do a recording and interview the lead member.
Can I just apologise? I always said it wouldn't be ready, but it was ready, wasn't it? And I'm surprised, because it looked an absolute tip when I walked past it. I'm just wondering, is it possible for us to have a look round it sometime?
If you would like to visit the school council, if you can send me an email, I will make contact with the school, because you can imagine we're getting lots of requests for visitors and all of that stuff. It's a new school, it's shiny and it's new and it's exciting. We really want the students to settle down, getting to routines, normalities. But absolutely, councillor, I'm sure it's something we can arrange at a time of mutual convenience in the not too distant future.
Yeah, thank you.
Excellent, thank you. We'll move on to the next item in the agenda, which is item 8, a report on the effect of the pandemic on the well-being of education staff. And that's with you again.
Thank you, Chair. And I suppose, colleagues, I know that collectively we will all have an interest in how well our staff who are servicing the education system are getting on, particularly the challenges that have been brought by the pandemic. There's lots of national data out there. on a regular basis. My officers are in meetings with education system leaders, head teachers, staff in schools as well. Tomorrow morning, we have our latest Luton Strategic Head Teachers Group meeting where we can check in with heads as a barometer. Our public health service are working very closely with my education officers, again, just to make sure our schools and our settings and environments are conducive to providing teaching and learning. We're keeping a watching brief on a daily basis with regards to the potential outbreaks and growth and an increase of COVID in our schools, because all of our schools have contingency plans and risk assessments, as you would expect. And if there is a particular outbreak and if there is an impact on the staff in terms of the capability of the workforce to provide provision and a high number of children, and then all of a sudden the environment isn't as safe as secure, then we will have to work with our colleagues at Public Health to make a decision on if that school can stay open or not. But in terms of looking after the workforce, to be able to look after the needs of our children, this is crucial. The paper before you gives an overview, gives some headlines, and in terms of the views that we're picking up, and obviously conversations with union reps and staff, and looking at national stuff as well. So I'd like to bring in my colleague Caroline Dawes. Caroline heads up school improvement for the local authority. Be well known to a number of you. As a lot of conversations with regards to our head teachers and professionals in schools and settings as well, but manages a team that has a wide reach. Caroline, would you like to give our committee members a high-level overview of what's in the paper, please, and your findings?
Sure, thanks very much, Paul. And good evening, everybody. So I've got a bit of echo going on there. I think Paul may still have his microphone on. Thank you very much. Okay, good evening. Thank you. I'm hoping that colleagues have had a chance to read the paper. And can I say how welcome it was for this committee to ask for a report on the impact of the pandemic on the well-being of our professional colleagues in the education sector. I think often, quite rightly, we focus on the needs of our children and young people, and it's important that we recognise the needs of the people who serve those young people, which are our colleagues in schools. I think you can see that the data from these surveys is quite shocking in relation to the impact of the pandemic on teachers, head teachers, support staffs, mental health in particular. It may not be surprising, but I think those are very, very high figures. There are 5 or 6 main reasons for this, which are detailed in the report. Workload was quite significant. I think whilst many people were working from home, we forget that teachers were in school or were actually teaching from home, teaching multiple children through online platforms, which they had to suddenly become experts in terms of a very different approach to teaching. Paragraph 10, I think, is one of the most significant aspects, which was a challenge to head teachers in particular, was around the frequent changes in government guidance. So I think it's important to note, and it's quite staggering really when we think about it, that in that first 10 weeks of the pandemic back between March and May 2020, we had 148 different new guidance documents, often detailing changes to behaviours and regulations which schools had to implement with immediate effect. That had a very challenging impact on head teachers in particular. Of course, people had their own health concerns. Whilst everybody else in the country was being told to socially distance, colleagues in schools, particularly those in primary and nursery schools, it's impossible to socially distance yourself from young children. So there was that additional challenge for colleagues in those schools. Teachers are very social beings. It's a social, interactive profession. Schools in bubbles, classes in bubbles, meant that staff were in bubbles, and it had they had very limited opportunity to discuss and work with each other In fact, for the vast majority of the last 18 months, staff rooms have actually been closed. And if anyone in the room has been a teacher or is currently a teacher, we know how what a blow that is to one of the main positive aspects of teaching, is working with colleagues. Schools are now right at the centre of catching up. So there's an expectation on schools, very high expectation on schools by the Department for Education, government, parents, about making up for lost time, pressure on schools to help children catch up with that lost learning. There's a small amount of resource to support them for doing that, but it means that schools and teachers have got a much wider range of learning needs to identify and to cater for. I think the last point in paragraph 14 is partly why I'm really pleased to present this report to the committee. There was a real sense sometimes amongst our teaching profession that they were a bit of the lost profession in the battle against the pandemic. Quite rightly, NHS staff lauded as heroes, absolutely right. And in the meantime, our school professionals were ploughing on, working in really difficult circumstances all the way through the pandemic. So I appreciate being able to sort of back their corner, really, in terms of supporting their views with this committee. We have tried over the last 18 months as an education service, to support our professionals in schools by being a bit of a buffer sometimes between government guidance and schools. We have tried to have really clear communication with schools in a measured way, so that we were giving simple messages to schools, cutting through all of this multiple messages coming from different areas. And I think schools have found that very worthwhile and very helpful in Luton. Certainly head teachers coming from other local authorities have reinforced that view. And we continue to support schools as they have pivoted back to the main business of education, which is, of course, teaching and learning and driving up standards for our children in schools. So we're really pleased to be able to say that our schools are back on track, being monitored carefully by our colleagues in public health, and we're very appreciative of the support that we get from public health in the partnership working that we have with our schools. So over to the floor and back to you, Chair, for any questions.
Thank you for that report, and I mean I completely agree that you know, teachers have been the largely unsung heroes, not only adapting to new ways of teaching where they've lost perhaps a great degree of the method of communication, which is, you know, tends to be body language, you know, adapting to remote working, remote teaching, as well as almost providing a service to look after children for those other services that have been classed as critical during the COVID breakout during the COVID period. These are quite alarming figures in paragraph 7 of the report. Is there, just a couple of questions really, is this a survey that's conducted on an annual basis? So is there a baseline in relation to I guess symptoms of anxiety and the symptoms mentioned here, and also was this survey broken down into region, or is it just purely national?
So thank you. This is a national survey from one of the unions. It's possible there's some baseline data available as well, but certainly I would not expect that to be reflected in these levels of responses. I think we've got a challenge enough in terms of recruiting teachers without having this kind of level of anxiety and sleep loss. So these are national figures, but are likely to be reflected in Luton. And I would hope that the unions do this on a regular basis, and in fact you would hope that they would continue to gather this sort of information to support colleagues in the teaching profession. We've I think been aware of it in Luton in terms of the risk around teachers and other education professionals, mental health and well-being, and so in our communication with schools, as well as the guidance in relation to teaching and children, we've been promoting and sending links to the health and well-being resources that are aimed at professionals. So we've used this data to support directing resources to colleagues in the education sector so they can have sources of support in Luton.
Thank you. And you mentioned health and wellbeing resources. What sort of resources are available to the teachers? Are you able to expand on that?
So there are many resources been put on by Public Health England and other organisations around health and wellbeing. Our own public health colleagues work closely with other local authorities in terms of health and wellbeing. We have our total wellbeing service, which is run by Active Luton, and there are lots of online support forums and lots of different places. The challenge is there are a huge number of resources and a huge amount of resources out there, and so we've been drip feeding links to well-known and well-regarded sources of support for professionals. Constantly really drip feeding that so that it's always there at the right time for people.
Thank you. And just one more question for me before I open up the floor. I see, I'm not sure whether it's the same in the teaching profession as it is in my day job, but I've always found sort of peer-to-peer support quite helpful. And obviously you mentioned earlier that staff rooms are closed. Has that situation changed now with the relaxation of the measures, and is there some kind of a process in place for peer-to-peer support, so teachers also supporting teachers?
Absolutely, and during the pandemic, schools were very imaginative in being able to provide that peer-to-peer support. So there were virtual staff rooms, there were virtual work meetings, there were lots of WhatsApp groups, and socially distanced staff meetings in halls, school halls, rather than staff rooms. So there was a real conscious effort to make sure there was still that connection between staff, because we couldn't agree with you more about that peer-to-peer support being absolutely vital. And I'm pleased to say that now if you walked into a school, the staff room is fully functioning, the classrooms are fully functioning, and I don't want to jinx anything and risk any huge outbreaks, but things are back to normal in schools in relation to staff working together, staff working with students, and students working together. So I'm pleased to say that is no longer the case in terms of no staff rooms. Obviously, that's part of the contingency framework that schools have in place. So in the occasions when outbreaks do occur, then they can step up those restrictions as part of their contingency plan. But currently, the vast majority of schools are operating as we know.
Thanks very much. Any questions from the floor? Yep.
Thank you, Chair. And before you open the floor up to our other councillor colleagues for comments on the back of what Caroline has just said and what's in the report, you asked a question about health and wellbeing support for our staff working in schools. Caroline has mentioned a number. There's a lot of information on the Department for Education website with regards to resources that are further available as well, some of which we have deployed to good effect as well. So there is a whole suite of activity ongoing to look after the well-being of our staff in schools. We're fortunate as a local authority, or a local area, should I say, that none of our schools have closed due to pandemic since they've returned in September. When I speak to directors up and down the country in other local areas, there are a number of their schools are challenged because of the pandemic, the rising numbers. We've had one or two wobbles, but from good partnership working between public health and education teams and working with school governing bodies implementing their policies in this area, we've managed to make sure that 100% of Luton schools have remained open for our children and young people despite the challenges presented by the pandemic. It's a daily situation where we keep on top of the numbers, where it's a watching brief. We have risk assessments in place, and obviously there may well come a time where that's not the case, where a school may have to close, or some schools may have to close. But rest assured, it's not a decision that'll be made lightly. But at this moment in time, making sure we have sufficiency of provision, we have sufficiency of staffing and infrastructure, and our environments and settings are as safe and secure as possible remains our primary objective.
Thank you. Dr. Mahad.
Thank you. Thank you to Caroline. My question is really related, not questions, observation related to the resources question. No one underestimate the impact, significant impact of the pandemic on school staff. School staff leavers have increased, including early retirement, anxiety, depression, and so on and so forth. But when we talk about the resources to support the well-being of staff, obviously we have resources available at national level, as has just been highlighted, and those are available at wider, beyond the local authority. And we all appreciate, I believe, the limited resources, if I may call it, that are allocated to local authorities. But I'm just wondering, from what has been said already, if there is any process in place to mitigate the effects of the pandemic further at local authority level, and also have staff in school been signposted to these important, resources that you've just highlighted. Thank you.
Yes, thank you. So in response to your last question, yes, the mental health and wellbeing resources have been signposted to all staff through the twice a week COVID update that goes to all schools, including nurseries, colleges and independent schools. So we've made sure there's very wide reach so that all staff have got access to those links. In terms of further resources or allocation from a local level, I think it's very important for schools and governing bodies to look at how they themselves meet the needs of their staff. This is not a centralised model. Schools know their staff well and are in the best position to do everything they can that meets the needs of their staff. And so I'm aware of a wide range of different sorts of strategies that schools are using. But to be honest, the one that is working best is getting back to normal, and schools, teachers spending time with the children, which is what everyone goes into teaching for.
Thank you. Councillor Lovell.
Thank you, Chair. Thank you, Caroline. I'm just speaking in reference to paragraph 14, and was wondering if my colleagues would agree with me that a form of appreciation is better late than never. If we could do something, because I totally do agree with this survey and how 60% of education staff have felt that if there was any way that we could right the wrongs and do something about showing appreciation for the education staff as well. At least if we can do it in Luton, that would be a start. As the clapping on Thursday started from somewhere, we could do that as well for Luton. So yeah, that's what I suggest. Thank you, Chair.
May I echo that as well? Thank you.
Yeah, absolutely. I don't think I completely agree.
Can I suggest that a recommendation from this committee goes to Hazel Simmons to see if she can sort something out for this?
Yeah, certainly. Yeah, I think we're all in favour of that. So, yeah.
Yes, yeah. I think it's important that we do that.
Yeah.
If we can.
Chair, can I just come in on that? And I thank you. I think in terms of the education system, like many other systems, has been under a great deal of challenge and stress during the pandemic. Caroline mentioned at the outset how welcome it was that this committee wanted to look at this agenda. The recognition, this goes a long way. This goes a long way, and we will feed this back to our head teachers and our colleagues in schools and settings, and the education staff who work at the local authority, because all of these folk come together to make the ecosystem that is the local area's education system. So the interest, the support and the recognition is greatly appreciated. Thank you.
Thank you, Chair. Are we going to take forward the councillors for the leader of the council?
Absolutely, yeah.
Right. Thank you, Chair. Councillor.
Okay, yeah. So we'll record that recommendation and put it forward. Yeah. Okay. Anything else on any other comments under this item? No. Excellent. So yeah, thank you for that report. And we note the content. So we move on to item 9, which is the public health funding for children's services, which is a report of the Senior Children's Integrated Commissioning Manager.
Good evening all, that's me, it's Michelle Bailey. My report is to just update members on our public health response following the closure of the Flying Start Children's Centres. I think it's important, you'll have all read and seen the report, but I just wanted to highlight a few points around the background and some of the challenges we've faced since the closure of the children's centres. So previously, part of our public health grant, which we receive each year, which is ring-fenced to cover certain items and needs to be spent on early intervention and prevention and cover key public health outcomes around obesity, oral health, safety in the home, school readiness, and various prevention outcomes. We previously funded the children's centres to provide some of those public health messages, stay and play, so to encourage families to come in and engage, and then they could attend health clinics. So the centres were obviously offered a variety of functions, but one of them was around a delivery site for our health clinic. So our health visitors had their child clinics there. There were distribution sites for our Healthy Start vitamins, and there was support for families to complete their Healthy Start forms, to receive vouchers towards food and milk. And also delivery sites for breast pumps, and families could collect toothbrushes and toothpaste. So obviously that was one of the challenges. So we working to deliver, have other delivery sites across the town, but that's been quite difficult when we haven't got any sort of building-based services anymore. So our response was just repurpose some of our funds that we previously used to fund children's centres, and we've commissioned a variety of services. The main one is with Early Years Alliance, and the reason for doing this is enabling us to keep the use of the Flying Start brand, which is a well-known, trusted brand across the town. There's a Flying Start strategy, which is a 10-year strategy, which is led by the Flying Start Partnership, that looks at all outcomes around the health and well-being of our children. And it's enabled us to keep the Flying Start website. So that's information and advice for families, whatever level of need. So if we go to point 11, I've clearly sort of set out how we've what services we funded and how we funded them and the cost of each of those services. So as part of the savings we made last year as part of the emergency budget from the public health grant, there was £172,000, which we've put into the family partnership service, which is a new service that has been developed by the children's services. This report doesn't cover that service, but it's just for members to note that we have partly funded that service, and part of that service must meet our public health outcomes. It can't be used to spend on statutory services. I've already mentioned that we've the children's centres were a site for our health visitors to access for their health clinics. That's been a real challenge. Obviously, in the pandemic, we weren't doing face-to-face appointments, so we've had to look at other ways that we can hold those clinics. So that's meant health visitors visiting people now in their people's homes. That's more time consuming, but we have brought in some self-weigh sessions in some of our active Luton sites, and our health visitors who are funded through our Healthy Child programme, which is another publicly health funded service but isn't part of this report. We work in partnership quite closely with Early Years Alliance and our other children's services across town. So what we've done is funded some community nursery nurses who can help support our health visitors and help support some of our more complex and vulnerable families with some parenting programmes around behaviour, toileting. So they have that support to try and prevent them needing to access more statutory high-level intensive services. We've also continued some funding for breast pumps to encourage breastfeeding. Our breastfeeding rates in Luton are really good, and through the pandemic we did see a rise in breastfeeding. Actually, we had virtual sort of group sessions on breastfeeding, and that went down really well. So we've made sure we've got enough breast pumps and consumables for women and families to hire, and that is being, rather than it used to be going through the children's centres, that's now being delivered by Cambridge Community Service, some of our health visiting team. Oral health, we're asking oral health to be everybody's business, so they all children's services have sort of oral health interventions, and we're recommissioning community dental services to do some supervised toothbrushing sessions in early year settings and sort of primary schools, but we've made sure we've got an allocation of money so we can provide toothbrushes and toothpaste to our what we call, I put UPP families, but it's Universal Partnership Plus, apologies for that, but that's our more vulnerable, disadvantaged families, and the health visitors will go out to visit those families to do their sort of early years checks, and we've made sure we've got enough money there that not only can they give a toothbrush to the child that they're visiting, but there'd be toothbrushes and toothpaste for their siblings as well. So because our oral health rates of decay are quite high in Luton, so that's another report in itself. And then Healthy Start vitamins, we have allocated some funding so people and families can access the vitamins, and there's access sites across 3 active Luton sites at the moment, so we've managed to alleviate that challenge. Then our main service that we've set up and is sort of in its implementation phase at the moment is our Flying Start sort of virtual family hub. I want members to note that this in no way replicates any of the services or the level of demand that was seen through the children's centres. It's just our response to the closure of that, and we know that the level of demand probably outweighs the amount of money or the amount of services that we can actually provide. But we have now got 5 community link workers in place, and they'll be working across the town. They've been allocated areas north, south, east and west and central in line with the 5 education committee areas. So they're already starting to make links with education settings, with GPs, with community groups in those areas and families in those areas. And the community link workers are based on our social prescribing model. So, and they'll be working with children from 0 to 11 for sort of time limited periods, and helping them to kind of signpost or find activities or groups or support, rather than kind of ongoing case management that we've seen before. So it's a slightly different approach, but we're hoping we can still reach as many families as possible. And each link worker has a specialism, so they're almost a champion for their area. So we have oral health, SEND, speech and language, so communication. We've still been able to some of our talking takes off programme, healthy weight. We funded Henry, which is a evidence-based weight management programme, and then child safety. So we've continued to fund the Safe at Home programme as well. So and oral health as well. So we're still getting those sort of public health messages across, and there's still support for some of our families out there. We've still continued to fund a speech and language practitioner and a SEND practitioner, because we realise the value and the importance of those areas. They are health staff, but they sit within Early Years Alliance, and they continue to kind of help with that sort of strengthening those partnerships. So there is an appendix that I'd put on which kind of shows the linkages of sort of Fly and Start and all the different services across Luton. And then what we're hoping for in January is we'll have some clear sort of communication. So we have done some comms on social media, but we're just trying to manage demand and implement the service. And then in January we'll do some joint comms with our family partnership service, so families are aware of what the new services are in Luton, but there is information already on social media and websites, and there is a referral form so families can refer themselves in if they need support. And the service is permission to be flexible, so we can see what our demand and our level of need is, and change accordingly if we need to. So any questions?
Thank you. Any questions from the floor, anyone? Yep, so
just a question on paragraph 5, I think bullet point 1, 2, 3. It says a healthy weight for more children in Luton. What is it, underweight or overweight? What do you mean by healthy weight? Are these children one of the key outcomes that's listed there?
Oh, well, a healthy weight would be within a normal range.
Right.
Sorry, it's echoey. So a lot of our children, or a high proportion, are overweight. So there's the National Child Measurement Programme that's done every year. We have high levels of obesity in children. The programme measures weighs children in reception and year 6, and then last year, because of the pandemic, it was paused. So our data for last year is there'll be a large lag, and it won't be as sort of accurate or as useful. So that programme has restarted now in this academic year, but last year they only were allowed to do a sample size of 10 schools, I think, across Luton.
CYP, is it children and young people or something else?
Yes, children and young people.
Yeah. Yes.
And then the other thing on children, on healthy weight, we have a child healthy weight strategy that's probably been to the group, but that drives forward our sort of plans for physical activity and healthy eating. So it's all interlinked.
Page 21. I mean, I know what Universal Plus is, UP is. What's UPP? You mentioned a couple of times in the you mentioned it in community nursery nurse, Cambridgeshire and community services in that, and you mentioned it in the CCS health visitors block there.
So there are different levels of need. So it starts off universal, obviously that's everybody, then universal plus, and then UPP is universal partnership plus. And then there's sort of early help, and that's where you get into more statutory services. But our health visitors, because of the level of demand and need, they focus on our UPP families, our universal partnership plus. So they're more vulnerable, probably more disadvantaged, and have more complexities to them.
So what is the criteria you measure this by?
There is a set criteria. I could share that to the group. I'll get that sent round. So there was a set criteria as to kind of how a family would fit in each level.
Okay, thank you. And SALT, I've just worked that out.
Oh yeah, speech and language therapy.
Yeah.
Yeah.
Okay, thank you. Thank you very much.
It's all right.
Thank you. Dr. Al-Ramahi.
Thank you. Michelle, you talked about the Flying Start Family Hub, and I couldn't agree with you more how important this to supporting the the overall service. But I don't understand why those type of programs, if you like, or sessions available to families in Luton, they apparently get cancelled every now and then, and quite frequently. And I have signed up myself for a session in October. I was really looking forward to it, but it was cancelled. And this session is key skills for supporting Luton families. It was a Zoom session, so it was a virtual session. I don't understand why it was cancelled. Thank you.
Was that provided by Early Years Alliance or Luton Adult Learning? I don't know of any sessions being cancelled. I can look into that.
It was coming from Flying Start Luton, and the cancellation I received last week for a session in October, virtual session. But I just thought to let you know.
Okay. I can pick that up with them. If it's a parenting programme, then I'm not sure that comes under the parenting programmes will come under the public health, what we've commissioned. I'm not sure about that programme, but I'll look into that for you.
Okay, thank you for that. Any Councillor Keane?
I wasn't going to say anything, but I must. How are you going to pick up the obesity in children now you've closed all these centres? Oh, you've gone quiet.
No, we have a child healthy weight strategy that we're looking at.
What does that mean?
And it's an action plan to kind of how we can drive forward and support our children, make them more physically active, and look at healthy eating, have health in all policies, so healthy policies in schools, so healthy sort of packed lunches. It's a sort of there's a steering group and it's a partnership approach, so we can tackle the obesity problem as a whole. Sally, you've got your hand up. Did you want to come in? Sorry.
Yes, thank you. If I may, Chair, I'm Sally Caron, the Interim Director of Public Health. Yes, so it is obviously a challenge, childhood obesity, and we are doing a lot of work to tackle that. As Michelle mentioned, there's a child healthy weight strategy, which is a multi-agency partnership action plan, and a lot of the work in that, the childhood obesity and overweight is a very complicated issue, and it can't just be tackled through one place. So it has to be multi-stakeholder, multi-partnership, whole system approach. So as Michelle mentioned, we are looking at provision through schools, education through schools, the Henry programme that we're still funding, access to green space, access to play, the child-friendly town work will help with that as well, the food plan. So it's it's not one person's business, it's everybody's business, and that's why the strategy brings together partners to tackle it through a multiple action plan.
So how are you going to pick up the obesity in children that do not go to school?
So it's not just schools that will be looking at obesity, so it's through other approaches as well. For those that don't go to school that are home educated, it's part of the curriculum still, and part of work around physical activity, nutrition, healthy eating, and all of those elements. Is also through active play, through access to green space, to access to play areas, through active travel and encouraging active travel. So it's the strategy and the action plan is through lots of different ways, lots of people, lots of different partners coming together around with actions around childhood obesity and healthy weight. The food plan also touches on a lot of this area as well, so they're all interrelated.
And can I add something as well? Over the summer, we funded Early Years Alliance did some family sessions. So they've had sessions in the park for early years and families, not only to tackle sort of the healthy weight problem, the healthy weight issues, but around the social isolation, because we found that obviously children hadn't been in school much last year, so they weren't interacting with their peers. They were very inactive. We also, over the summer, we were really fortunate, actually, my colleague Caroline Dawes, that's on the call, managed to obtain some Department of Education funding for holidays, activities and food programmes. So we've had £1 million of funding, and we've run sessions in Easter, and over the summer we've had 4 weeks of summer camps, mainly aimed at our children with free school meals, but also we widened that out to our looked after children, our SEND children, and all children in Luton could actually pay and attend the sessions, and that was around physical activity, healthy eating. They were provided with a nutritious well-balanced meal. We also were providing children with breakfast, because we were finding they were coming to the sessions, their behaviour wasn't great, but we found out they weren't having breakfast. So we're tackling it from all angles. So there might be... Sorry, carry on.
So suddenly we've found all this money for looking after their children. Why did we close the centres in the first place then? Because it wasn't really properly budgeted anyway.
Sally, you're going to answer that.
Can I come in? So the holiday activity and food money was bid for national money that we bid for specifically for that purpose, specifically about holiday activity and food provision during the holidays, particularly for those that are the most vulnerable. The closure of the children's centres, I'm sure, has been discussed at length previously, so I don't really want to go into that, but we are aware that it's challenging. What I was going to suggest, though, was that if the child healthy weight strategy comes back here for discussion, there's some work happening at the moment to refresh and work through the action plan and do some further work on that. So I'd have to confirm the exact time frame of when it would be ready, but I think it'd be helpful if it came here for discussion, if that would be appropriate.
Yes, no, we can add that to the work plan. If I may, and apologies for my ignorance, but in terms of what you've mentioned, these are all sort of actions to reduce or avoid obesity. How are you going to be measuring the obesity going forward now that these centres are closed? Where are these sort of children going to have their weight measured and so on?
Sally.
Okay.
God, you can. No, well, there's the National Child Measurement Programme, which is a statutory programme. So we measure all children in reception and year 6. It was paused last year because of the pandemic, but it will be restarted, and that's our measurement, and we have to report on that annually.
Okay, thank you. Any follow-up?
The only comment I've got to make is really it was a big mistake in the first place to actually even talk about closing these centres. And we all opposed it, but it still got through for some unknown reason. And I'm sorry, it was a big mistake. We had a system there which was excellent. It did everything it wanted to do. And we just threw it away as usual. And I'm sorry, that's it. Big mistake.
Yeah, I agree, and I think the report does acknowledge that the measures that are put in place here don't compare to the centres. Councillor Lovell, did you have a...
Yeah, thanks, Chair. Michelle, just wanted to something that you said just brought up this question for me about oral health and dental decay, and you did say that that was a report in itself. So I would, yeah.
I've reported on that to a health and social care review group. Oral health, there's a public health outcome measure. So we measure children's decay, missing teeth, and we are above the national average. So I say I have reported on that to a different scrutiny committee. So I could happily share the report, or if you wanted a more in-depth report, I could bring that back. We have a oral health needs assessment that we just completed, and we're developing not a strategy but a higher level action plan, and we're putting measures in place to kind of combat the issues or mitigate against the issues around tooth decay. But we're trying to make that everybody's business, so that's why we've included it in all our sort of new services, and linking it into our healthy weight strategy as well, because it's around healthy eating, so everything's sort of interlinked.
If I may ask for a detailed report, please, to be included in the work programme.
Yeah, so we can add that to the work plan. Yeah, yeah.
Thank you, Chair. Thanks, Michelle.
It's okay.
Any other questions or comments on this report? No. Okay, thank you. So thanks for the report. We note the report, and yeah, we'll follow up with the dental report in the action plan for and a working plan for future meeting. Okay. Excellent. So we'll move swiftly on to item 10, which is the Children and Young People's Mental Health and Wellbeing Report, which is by the Senior Integrated Commissioning Manager for Public Health.
I'm taking this one, if that's okay, Chair.
So yeah, thank you.
So this report was requested. My understanding is that a year ago, a report on children and young people's mental health and wellbeing came to this group, and a request was for an update a year hence. So this report just updates on where we are. We are currently, and unfortunately not quite complete, but currently completing a children and young people's mental health needs assessment, which will lead to an action plan and an updated strategy document. The draft report is part of the papers. It isn't yet final, and very happy for myself or colleagues to bring back the report as a final version once completed. The key recommendations are likely to include taking a full strategic approach to bring together partners and the recommendations into one strategic document, having a getting better data from services to inform decision making going forward, using data and actions to reduce inequalities and meet the needs of more vulnerable groups, making system efficiencies, continuing to promote prevention and early intervention around emotional wellbeing and mental health, and target areas to include transition, crisis and eating disorders. The needs assessment, once complete, will inform the BLMK local transformation plan, which will be refreshed at the end of this month. This plan is updated regularly and agrees transformation priorities across Bedfordshire, Luton and Milton Keynes. So the draft high-level findings from the needs assessment are part of the papers. That it shows clearly some evidence of the impact of the pandemic. It's showing high levels of need and impact, and particularly in those vulnerable young people in Luton, particularly coming out of the pandemic. So the information in that needs assessment is still draft and still being worked on. So I don't want to go into it in too much detail, but very happy to bring it back once it's complete in due course, which should be over the next month or so. I'm happy to take any questions, but it's quite a brief report at the moment, but happy, as I said, to bring back once we have full information. Thank you.
Thank you. Any questions, Councillor Keynes?
I've only got one really. It says discussions with commissioners. Who are they? What are they?
Commissioners are those either within the NHS or within the council that purchase services. So you'll have a commissioner and a provider of services. So the provider will be the mental health trust or the voluntary sector organisation that provide health or care to individuals within the community, and the commissioner is those that give money to that provider to provide that service.
Right. Okay. Thank you.
Thank you. Any other questions, comments? No. Okay, thank you. Yeah, thanks. As you said, it's certainly at perhaps early stages and quite a brief report at this stage. So yeah, I'll certainly add this to the work plan to come back when we've got more to scrutinise. So yeah, thanks for that report, and I think we note that. Oh yeah, certainly. If you'd like to, yeah.
I think our colleagues in presenting this paper, there's a significant programme of work going on across the local area professionals and partners, and there's a big programme of work going to be going on with our local schools and settings and head teachers and education system leaders as well, which will see this item discussed at future head teacher meetings as well. So we're very keen that our schools, as the biggest provider of universal services to children and young people in the local area, and obviously we recognise the impact of the pandemic on our children and young people in this regard as well. Schools have got an important role to play here in terms of supporting this agenda. So our colleagues, our health professional colleagues, in terms of refreshing this strategy and bringing together all the different activity of work underpinned by this very helpful needs assessment, will allow us to be further targeted. But there is a programme of work and engagement that's going to be ongoing. So I think in future months, if we could bring this back, absolutely. I think looking at that integrated systems approach, the impact of it in terms of engaging with system leaders and progress being made, I think as part of an overarching approach, it would be quite welcome and timely.
Absolutely, yeah, completely agree. Thank you.
I've just got one more question.
Go ahead, Terry.
What's CHUMS?
CHUMS, I don't think it's actually an acronym. It might be originally, but I don't know what it stands for. But it's a voluntary sector provider that provides mental health support for children and young people across Bedfordshire, particularly around bereavement support, but some other mental health support as well for children and young people in Bedfordshire.
So it doesn't actually stand for anything?
It might do originally, but I'm not sure. It's just the name of them. It probably does. It sounds like it does, doesn't it? But I don't know what the acronym is.
I made something up. Children's Health and something else. Okay, thank you very much.
No problem.
It's a very good charity, CHUMS. Yeah, really doing awesome work with young people with bereavement. Yeah, so you could support them.
Thanks everyone. Any other questions or comments onto this item? No. Okay, so so we note the report. Thank you. So we move on to item 11, which is to look at the draft work plan going forward, which is. We will. I've got a meeting scheduled with Amanda to discuss the the work plan. So,
but I mean, on the 23rd of November, it seems to be so much.
Yeah. As I say, unfortunately, Amanda's on leave at the moment, so I'll be catching up with Amanda to discuss what we do on going forward. So these are only draft proposals, and certainly taken on board some of the suggestions today for the work plan. I'll have a meeting already scheduled with Amanda to discuss what we'll bring in future, but certainly in terms of what we've got written here in the draft, if anybody's got any comments or anything else that they want brought forward, please, do feel free to let me know. Councillor Lovell, yeah.
I was just thinking, Chair, that the headcount for permanent members of staff, I mean, could that agenda item be moved to the next meeting, or to either, if it's not urgent, I mean,
Yeah, certainly. Certainly. We'll look at that and but potentially move that to a later meeting for sure. Okay. Yeah.
Thank you, Chair.
Yeah. Councillor Petts, yeah.
We haven't heard from the Youth Justice from Dave Collins for a long time. When is he due to come back to us? It kind of indicates 22, but there's no dates against it.
Yeah, so he's listed under the meeting for the 23rd of November. Dave Collins, Youth Justice Plan for Luton 2019 to 2022. So certainly on draft for the meeting in November, and if it's not in November, I'll make sure it's one immediately after that, for sure. Thank you. Any other questions or comments under this item? No? Excellent. Okay. So I think that we've got nothing under item 12. So I think we can, in that case, close the meeting. Thank you all for your time. Thank you. Cheers.